dun, the Progressive Care Unit. Dun, dun, dun. The Progressive Care Unit, the PCU, is a telemetry unit that delivers care to a client defined by acuity as an intermediate level of care. Patients in the PCU are considered at risk for the development of unstable arrhythmias and/or their condition could be potentially compromised. Modalities and therapies include, but are not limited to continuous EKG telemetry monitoring, oxygen saturation monitoring, maintenance of low-dose vasoactive drips, or antidysrhythmic drugs that do not require frequent titration. In many healthcare facilities, the lack of intermediate care area is a major problem. Initially developed in the 1970s to care for clients with myocardial infarction who required cardiac monitoring, they now care for a large variety of clients. Historically, these units have grown in number to accommodate patient populations. Over the past several years, the PCU population has grown at an enormous rate. The variety of clients being cared for in these units are expanding as well. In response to this growth is the determination that more facilities need similar departments in their own realm of patient care. Mortality rates may be lower by discharging clients from an ICU to the intermediate care area or PCU simply by allowing the appropriate level of care to be provided for their determined acuity level. Clients and their families are also more accepting to the more fluent transfers throughout the facilities. They see the transition from one level of care to another as a step towards getting better and not as a giant leap towards discharging home. Overall, this structure of care provides a better perspective of care throughout the entire process. Competencies of the PCU nurses are covered in many articles ranging from identification of the knowledge of the nurse to the skill set required to practice in the PCU setting. The PCU is a particular area where specialty educated and trained nurses combine their knowledge and skills of assessment, surveillance, and provision of complex nursing care to provide high quality care for the client. Evolving during the past several years, these competencies have been specified by the American Association of Critical Care Nurses, the AACN. Whether broad or specific, all required competencies, training, and scopes must be well documented. An organization's process of defining its strategy or direction and guiding the process is described as strategic planning. Knowing where the facility is currently and where it would like to be is also part of the implementation process. A process of getting from point A to point B has multiple routes. However, one used often is the process known as using a strategic. Implementing a PCU into an already established medical surgical unit will allow for increased revenue due to higher billing for PCU care, with little to no incremental expense. With the current billing price of a medical bed accounting for roughly around $1,500 a day occupied, the same bed with the status of PCU accounts for roughly $3,100 each day occupied. This new service will care for higher acuity clients needing additional support and specialty care. These nurses will need additional education and training in areas of advanced EKG, electrocardiograms, ACLS, advanced cardiac life support, advanced medications, skills, and PCU competencies. The American Association of Critical Care Nurses points out that progressive care nursing has expanded beyond the basic cardiac telemetry that marked its beginning and now encompasses many of the same techniques and therapies that were once limited to critical care units. Currently, the systems in place will allow for the proper housing of this clientele. Upon the disclosure of how the department will be implemented and the financial gain expected from the venture shall ultimately sell itself. Once communicated to the staff, the managers must talk to them and gain the insight on their thoughts in opening the unit. Valuable information can be gained by simply listening and taking into consideration some of their concerns or ideas. With Obamacare, or the Affordable Care Act, there is an increase in the number of Americans which now have access to health care services. This increase in the number of clients to serve will ultimately create a need for the construction of more healthcare facilities across the country. The overall environment of care will become a more seamless transition of care. As the client's needs increase or decrease, so will that individual's level of care. Staff resistance is one of the most common social barriers encountered during the implementation process of any department. By simply communicating to the staff the desires and the plans of the project, the staff will feel empowered. The fear of the unknown is no longer there, which in part will decrease the future pushback or resistance. Frontline staff, which obtain management positions and ultimately higher administrative leadership roles, will have the ability to make changes which they are aware which need to be revamped. Caring for individuals with increased acuity levels or requiring closer surveillance is the priority of the PCU. The determination of appropriate safe nurse staffing challenges the profession to become creative with their mix of professionals to adapt to the populations of clients being cared for. The elimination to any plan in nursing can easily be made or broken swiftly with the proper or insufficient staffing ratios. In conclusion, the PCU is an overall satisfier for many healthcare facilities. During the past several years, progressive care nursing has become a recognized specialty, from decreasing mortality rates to increasing satisfaction levels of employees and clients. The PCU has made many changes over the past several years. With a growing population, more and more facilities will be implementing these departments into their own dynamic structures soon. Check out those resources. Thank you.